Now, yesterday in class, we said that with the acute artery, coronary artery, a vein travels with it. So we had the acute coronary artery going this way. What vein was traveling with it?
Small.
The small cardiac vein, just like this. Now, when you tag on the table, it's going to do that, okay? But we're going to stay consistent with what we saw in the model and consistent with what you would see in Netter's and any other text, okay? So that's our small cardiac vein, and that's how I would tag it, which tells you I will not tag it on the table. I'll tag it on the model.
Why would it be so inaccurate like that? Or is one inaccurate, one's not?
I don't know. Yeah, I don't know. It's either the way they stained it, or it's the way they did the updates, or it's the computer program they used, or it's when they actually did the dissection or the prosection for the cadaver, maybe it got cut away in this one, but we might actually be able to pull up another table and see it.
Because you can kind of confuse that for the grate, or am I mistaken?
Well, the grate will be with the anterior interventricular. Yeah. The only one you could confuse that with, and technically, I mean, the reason why they're calling it the small is because this vein does not drain into that right atrium. Instead, it goes back and it drains into the coronary sinus. The small one does that. The great does that. The middle does that. So they're calling it the small for that reason. But here you see the ones I have highlighted. Those are the anterior cardiac veins. And I know that because they are attached to the right atrium. And remember that anterior cardiac vein is special and it goes directly into the right atrium. Now as I rotate this back to the midline, and we see in between the right and left ventricle, we come to the great cardiac vein. So the great cardiac vein is going to be in the exact same area as the anterior interventricular artery, okay? Right in between the two ventricles. Okay. Now, if we turn the heart upside down and we're looking at the posterior aspect of the heart, we're now seeing the middle cardiac vein. You get that middle cardiac vein. Now that's traveling with that posterior interventricular artery. Okay, so traveling with posterior interventricular artery, middle cardiac vein. Now all of those are going to join together into the coronary sinus. Okay. So remember, great, middle, small cardiac vein, and all these other accessory veins you're seeing here, all drain into the coronary sinus, and then they drop into the right atrium. The only one that does not do that is that anterior cardiac vein. That one goes directly into the right atrium. But when we look inside the right atrium, we're not going to see openings from that anterior cardiac vein. We're only going to see an opening from the superior and inferior vena cava, and then we're going to see the ostia for the coronary sinus. Because again, it's fairly substantial in size and it's receiving blood from lots of different areas, so it's got to be pretty big to accommodate it. This one's just little individual spots and we typically don't see them. So those are all the arteries, and those are all the veins, okay, that are associated with the heart itself. So what I want to do here is I want to let you guys go to your tables, and I want you to try to find these as best you can. The heart that I pulled up here is the female